If this was any, if there was any other country that had universal healthcare, I say you should definitely go to the doctor. Here in the U.S., um, that be my one flag against capitalism in the United States. Capitalism, I said big, support capitalism and everything, but I do truly believe that of all the industries, healthcare should be the one industry we should not be allowing capitalism into, because we shouldn't be having cases where people are not able to afford the things that they need for their very livelihoods. That should not, that of all things, that should not be allowed. There shouldn't be a reason why. What was it? I still remember to this day, during Trump's presidency. It was either the first or the second Congress under Trump's presidency, where like their very first hearing was about a woman whose daughter died because she couldn't afford the penicillin. Like that, to me, that's crazy, right? Anti-venom, like there's like some really bad poisonous animals we got here in the US, like over there by Texas, Nevada, whatever, bro. The anti-venom for like some of those at one point was $62,000, right, for the full course treatment. If your child got stung by these, right, and you did not have insurance, and then even if you did have insurance, you still had to pay like a grand or two. I even think cancer is an industry. Maybe they might be. There's a lot of stuff to be argued about, like about certain aspects of the healthcare industry for sure. And why is that? That's because of the capitalism. I mean, that's really because of the capitalism. I think like if we could at least carve out capitalism from the healthcare industry, at least, right? It'd be all good. We shouldn't be in we shouldn't be in a society where profits is a focus on somebody's life, on trying to get somebody's life to be all right. That to me personally, that's kind of crazy. That is like really crazy. And that's why like a lot of other countries sit there. You can argue about the quality of their healthcare system, whether that Canada, the UK, and what is it, New Zealand, like whatever places that have universal healthcare or whatever. But I mean, at the end of the day, like if humanity in its entirety was to just agree on that, like, look, capitalism or whatever style you have is all good and anything, but keeping profits out of the healthcare industry, period, right, would be something that would be good for all of humanity. But that's just my 2 cents. It's already too late. Like capitalism is too entrenched, at least here in the U.S., right? Because then a lot of doctors won't be making nowhere near the amount of money that they make anymore, and it would be kind of crazy for them to go through like 10, 20 years of school just to then only make like a small amount of money. So I don't know. Do you think the U.S. should have a free healthcare? Um, Probably. Uh, the way I look at it, the way I honestly look at it is like this. Um, if if we're gonna do a bad job making sure that if we do a bad job at controlling the environment so that you don't get sick, then at the very least we should at least help. We should at least do something about your healthcare situation should you do get sick, right? If I can't sit there and like was it Michigan, the Michigan was it Michigan with the pipeline shit, like we had lead in the pipes and whatnot because they're trying to cut costs or whatever, right? You got this thing where like we don't regulate all the chemicals, right? We have a burden of proof where a company has to show, like somebody has to show that something is not safe to be used before it's used in the US. Like it's all these different things. It's like if you're gonna have it this way, then you should probably actually honestly you should probably make healthcare affordable and easy for, at the very least, by free, like not free in the sense where you don't pay anything, but at the very least, like there should be a point of entry that everybody should be able to do in some way, shape, or fashion. It can't be this thing where if I'm unlucky and I happen to live in an environment where like I'm in an old house that has lead paint that's chipping like all over the place in my house or in my food, or the pipes in my water system, right, or slowly seeping mercury or whatever it is into my brain, like all this stuff is just is just crazy. I actually don't know anymore. Wait, am I persuading you to like go social? It's that's only my only argument specifically with healthcare, right? Everything else, I as far as I know, as of now, everything else should be good to just be as it is. But like healthcare specifically, just because like our entire situation is uncontrollable, and we rely on the government for a lot of things to be safe. Quality of air, the quality of air of the city that you're operating in, right? The safety of your drinking water, the safety of the public water fountains, the safety of your food that's getting packaged and hopefully was inspected properly, being tested and managed properly, right? All these different things, like you rely on the government for a lot of these things that can make you. I'm secretly pro free healthcare. Yeah, I truly believe that it needs to be, it needs to be an inherent right for everybody if we're gonna be in like this kind of environment, right? I say we rely too much on the government to be able to live and not get sick, right? There's too many things that we do in our day-to-day lives, right, where like the government has a responsibility to make sure it's safe and okay for us to be able to do so that we don't get sick. E. coli poisoning, right? The stuff that gets into the meat, contaminations, when what is it? Those things where like people are dumping stuff into waterways and whatever. Like we expect the government to like step in and to police those up so that you don't get screwed. Because the thing is like especially in the U.S. and you don't have healthcare, it just takes one bad experience and you're hoed. Like you are literally hoed. Like one of the nice things Obama did at the very least was just made it like when we talk like your credit, because your credit like has a lot to do with your ability to be able to finance a house, car, and all that stuff, right? And the thing is that like people were getting healthcare bills that you just will not pay. You just cannot pay. Like what, like a 5-night stay, and then you was looking at a bill of like $30,000, $40,000 and stuff, and it's like, I'm not paying that. And then it hit your credit report, right? And then that's it. Now that's it. Now any credit cards you get, right, the interest is gonna be crazy high, right? You're gonna probably get denied on like financing a car, or if you do get a car, the interest rate's gonna be crazy. Oh, don't even talk about financing a house, right? And you got and you have a healthcare bill that went into collections in your credit report. Like all that stuff, like, bro, used to be crazy. And at the very least, like I if I'm not mistaken, Obama like signed something, right, that took at least that part out of credit regulation, right? Let me see real quick. Bro, why? Oh, because I'm clicking the wrong one. Obama credit law hospital bill, right? My proposal will remove medical debt from credit reports. This is 2024. Governmental bill eliminating medical debt. Yeah, see, signing the Patient Protection and Affordable Care Act, right? So yeah, so like medical debt from credit stores. Yeah, I really remember that. A doctor is a trained professional, and you must pay. Yeah, and see, and this is the thing, and that's just really because it's just like how we structured humanity, at least here in the U.S., in the Western side of it, right? How we just structured the whole healthcare system to be, right? Because to be fair, right? These doctors, to be doctors, right, go through a hell of a lot of training and stuff for many years. Like the commitment is insane for them to be like to be a brain surgeon. Like that's, how long does it take to be a brain surgeon? Why? How long does it take to be a brain surgeon? 14 to 16 years. Could you imagine committing yourself to 14 to 16 years? And then the hard thing is that all of this is linked to other industries and other things that also become a problem too. 14 to 16 years, like you're committing yourself for a long time, and then to what? Get paid like what, like $50,000? Like you're not going to survive off of that. So it's like that's the other coin to the argument too, that like that people that we have to sit there and we have to agree, right? But the education, but I mean, one thing you could probably do is you could just make the education affordable, right? The only problem is it's just just the cost of making that education affordable, because somebody got to pay for it, right? Like, how much is that going to be? What are we going to do if somebody ends up dropping out? Do they need to pay that money back? Or let's just like, it's a lot of really hard, tough questions. that you really need you need somebody in the government to actually want to actually solve the problem, and put a committee together that actually sits there and does the research, investigates, pulls all the smartest minds together to figure out how do we do it. The thing I will say is going to be this, is that like some changes are going to have to happen eventually, especially once AI gets developed to the point where it's operating just as effective as the humans are. But like, we're gonna have to figure out something and do it pretty quickly. Otherwise, society will collapse, right? Because then people won't have jobs, and then it's a wrap after that. But see, now that's getting further down the line. Just healthcare specifically, I would be really curious to see how the other countries are doing it. That have universal healthcare. I wonder how much. Maybe doctors can. I mean, a doctor doesn't. Does a doctor really need $200,000+ a year to do it? Now, and then the other side of that is just that, well, I mean, the debt that they probably took on was probably $250,000, so maybe, right? And it's just, it's all hard. It's all really hard stuff for sure. All right, let me see what can we look at here. Euphoria Live. Oh, he did the other songs too? I was thinking it was just like not like that. If I spent 10 years in education, I'd want. Yeah, you see, that's what I'm saying. And that's fair, right? 10 years? Like 10 years. 10 years of nothing. Like you have to go through your entire childhood in school, and then you have to spend almost that exact amount of time then going to school again. Like it's crazy. It would be crazy. I think what? So I think in technicality, if I was to do the short end and say it was 14 years, and you knew from the day, if we knew from the day your umbilical cord was cut from your mom that you was going to be a neurosurgeon and you was going to work really hard, I think the youngest you could probably graduate out of high school is maybe like 16 or 15. Like if you're like really excelling like that, and then if you go straight to college and then straight to medical school, you could be yeah, you can get to 29, 30. Yeah. There's no quick easy answer for this. Like you'd have to put a committee together. And they'd have to spend like, they had 6 months to a year probably researching and like trying to figure out like what's the best answer to this. But like the system we have now, honestly, is just too crazy. There's too many different ways when it comes to healthcare where your life can literally be ruined. Like it literally can be ruined. If it's not to actually save your life, it's to have a quality of life. When it comes to then like trying to get prosthetics, right? If you end up losing a limb or something, it's one of those sticking points where like I will like break away from Republicans real quick, and that's just like over healthcare, just because like I've seen it. I've seen it firsthand. I remember I had a friend, I might have told the story before, but like his wife had to give birth early, so the baby was it was a prenatal, I think it's like the term for it, bro. And then like they were the baby was in like in the intensive care unit, the prenatal ICU or whatever, for I think they said for like 6 days or something like that. And he had he was in the military, and he was in the military in the reserves, and like after it was all said and done, he they got home, baby got to be good and everything. There's all that. He got the hospital bill, and he was like, the hospital bill was I think he said, what was it, like $70,000 or like $60,000 to $70,000. And the thing is, like, people don't know, but like at least in the military is the healthcare system would actually be the closest thing you could probably find as a social healthcare system, because everybody gets it, and then it comes out of like the taxes and stuff that you pay, and then for the reserves specifically, you pay a very specific fee, right? That doesn't change or anything, whether it's for you specific fee, and then if you're insuring your family, then it's this other fee. And yeah, no, but that's the thing. They did. But the thing is that he had the health insurance, right? He had the health insurance that covered that $70,000. He got the bill. He gave it to TRICARE, right? The people in it. That's it, right? Good. And I'm just trying to think, like, but like, if you wasn't if you wasn't in the military, like, how much money do you think you'd have to unless you have like really, and this was 2014. 2013. So like, I don't even know if like Obamacare was like in full rollout back then. So I'm just like trying to think like what kind of health insurance would you had, because you would have probably had to have like a really high premium paying health insurance for that to have been fully covered. Otherwise, like, you would have probably been sharing some of that cost and it would have been a wrap. And that was the reason why one of the things Obamacare did was institute a cap on like your out-of-pocket expenses. Like, once your out-of-pocket expenses exceeded a certain amount, that was it. It was stopped there, and then the insurance company would have to cover the rest of it. So, like, it's just like too many people's lives get ruined by like by just healthcare related stuff. Like, if it's just one of those unlucky people, you get in a car accident or something, right? You get hit by you get hit by a cow, right? And you get some like crazy medical bill that just like really puts you under, right? And if it wasn't for that, it would have been like through your credit score. And then now, like, it's hard for you to rent an apartment, right? Apartments do credit checks. Like, too much stuff. It's just too much of it would impact your life. It's just crazy. It sure is. It sure is. All right, we are going. Okay, I'm actually going to switch to now just doing this for. Wait, what happened? Jesus Christ, man! Stop it. Oh, is it because I changed the full screen and that's why I did it? Okay, so I need to go back to pause here, go here, and I just want to set up my initial stuff first, and then we can go ahead and I'll put you over here. Okay. Hold on. I want to get like just a few things built. Damn, I went really far from my base. The problem is the titanium drill, I think. Doesn't it still need electricity? Oh no, it doesn't need electricity at all. Okay. Oh, cool. So we actually can start like building this. Okay, hold on. Come on. Zoom in just a wee bit here. Put you, and I guess I can save. Healthcare is one issue where I'm kind of liberal. Yeah, it's just like, like healthcare is just one of those things where, like, you know, somebody like your humanity, you have to default to the side of humanity. Like, it's just like any other way, and people just like become at risk of just like the luck of the draw. Like all the people that get born with certain diseases, all the people that get infected and can get like maimed by just catching something. I couldn't imagine like just traveling the world, right? You travel the world and you pick up some goddamn like brain parasite that that'll sit there and like mess you up. It's just it's all crazy. It is all crazy. Oh no, I need to hold on. Did I just okay? But healthcare is the only industry I can think of. Is the only one I can really think of at the top of my head where I'm like that, where like I think it would probably be better to be a little bit more liberal with it. Everything else I think is good to just be on the capitalism side, but I still argue that eventually we really should like think about transitioning to a socialist system at the rise of AI, because AI is going to really nuke quite a lot of jobs, and it'll do it really fast. And then the worst thing is that all the big businesses that love capitalism, that like swear by capitalism and how you should be working hard and sacrificing everything like that, they're going to turn on you very quickly once AI hits the point where like they can transition the entire corporate structure to AI and not have to pay anybody anything. That is immediately what's going to happen. Can I? Jeez. So that's the only thing. That's the only thing that kind of like just like makes me upset. Like whenever I hear like just the most richest people, then talking down on these like socialist policies and everything, but then won't sit there to admit some of the problems that capitalism can have, which is like the healthcare is like one really big example of this for sure. Um, as a matter of fact, isn't oh shoot, my robot is about to start sweeping the house. I need to because I did not prep the area for that. I forgot to do it since I was streaming. I am going to. Oh well, actually, I think no, I have my phone there. I'm gonna be right back. Oh look, see, my robot is a perfect example of that, right? See, now I no longer need to spend time sweeping up my whole house. I have a robot that'll literally sweep up my house, my carpet, and I'm happy. All right. And then someday I'll get the ones that can also mop at the same time. That'll be really really nice as well. Can I do this? Yes, I can.